So again, thank you for joining us. I would like to introduce Janet Gomez from Torrance Memorial Physicians Network. They're the people who are the group that is sponsoring this session today. And with that, I want to welcome you, Janet, and look forward to the session.
Thanks, Julie. Hi, everyone. Thanks for joining us. Before getting to our presenters, I just wanted to really quickly introduce us as a network and what it is we do. So I'm just going to jump right into it. We are a multi-specialty medical practice, and we are part of an integrated health system. What that means is that we align ourselves really closely with the hospital, Torrance Memorial Medical Center, the medical group, Torrance Memorial IPA, and the clinic setting, which is us, the Torrance Memorial Physician Network, to provide care coordination, easier access with a shared electronic health record, to provide quality care, and overall just a great patient experience. And we serve the South Bay area. If you're interested in learning more about the physicians presenting today or any other physicians within our network, please give us a call at 310-891-6717 or visit our website at tmphysiciannetwork.org. So I just want to introduce you all to our speakers who are coming in. Thanks again for joining us today. We will be discussing routine vaccines, cancer screenings, and their senior annual wellness. We have Dr. Torna, who specializes in family medicine and is located in our Rancho Palos Verdes area, very borderline to San Pedro area. And she will be touching on our routine vaccines and cancer screenings. Dr. Mejia, he specializes in family medicine and sports medicine and is currently located at our Hermosa Beach location. And with that said, I'm going to present it over to our first speaker, Dr. Mejia.
Thank you, Janet. Let me share my screen here. Perfect. All right. Well, hello, everyone. Thank you for your time this morning. As Janet mentioned, my name's Matthew Mejia. I work in the Hermosa Beach clinic, and I specialize in family medicine and primary care sports medicine. So today, what I wanted to discuss with you guys is the senior annual wellness visit. Now, this is a pathway for you. And so let's get into this. Let's jump into it. So what is the senior annual visit? So basically, or where did it come from? Basically, it's expanded coverage from a preventive health care service. So it started about 2011, 2012, and it really entails kind of a step back in looking at your overall health. You know, it was originally for Medicare beneficiaries enrolled in Medicare Part B, and it consists of an initial annual wellness visit and subsequent annual wellness visits every 12 months. And so, you know, why do we have these? What's the point? Don't I see my doctor every couple times a year, if that? Well, there's a couple reasons why we have these at this point, is because most of us are living longer now. And so instead of numerous smaller visits, this gives us the ability to take a step back and kind of assess your overall health. You know, most of us are living a little bit longer now. And so with living a little bit longer, there's, you know, multiple chronic illnesses. One, as some of you may be aware, they kind of just tend to stack up on each other. And so, you know, it's very important that we have this type of appointment to kind of look at the whole 50,000-foot view. You know, with these multiple chronic illnesses, there's an increased vulnerability to disability too, right? So the inability to ambulate well, you know, decrease your muscles and your bone strength, and increase the risk of a fracture or any type of injury if, say, you fall, for example. And so it kind of goes into my next point as well in regards to, you know, increased fertility rate as well. So if you don't use it, you'll lose it. And so again, this helps us try to identify certain things that may benefit you, either resources or referrals, to improve that quality of life, which we'll be talking about in a moment. And so again, with these increased multiple illnesses, with the disability, the vulnerable to disability, the increased frailty rate, we want to make sure that you have an increased quality of life, not so much a diminished quality of life. You know, what's the point being 10 years older if you're not happy with where you're at, with how you're feeling mentally or physically? So again, that's one of the reasons why we have these visits, started in the early 2010s. And so, many times people can be confused, or even physicians can be confused. I mean, this actually isn't necessarily meant to be a wellness exam. This is a wellness visit. This is a conversation with you, and either with a loved one in the room as well, with the physician, to really get a bigger view of where your goals are, what your values are, as opposed to listening to your heart, listening to your lungs, and talking about 1, 2, 3, 4, 5, 6, or however many other conditions there may be going on. So it actually is more of a wellness talk as opposed to an exam. And these visits are actually underutilized. I know it here through TMPN, we do a pretty good job of trying to bring in people yearly on a very minimal basis to do these wellness visits. But when it first started in 2011, 2012, only about 15 to 20% of people eligible were taking advantage of these visits. And up to about 2018, I believe, as well, is about 50 to 60%. So while we may be doing a pretty decent job here at TMPN, I mean, those with your family members or friends that may live out of state, this is underutilized. This is a very great tool that can be used to really focus on your overall health. And so the visit's meant to be your overall care plan. And so it deals with preventive health, disease screening, and also the coordination of care. So again, talking about not so much what medications, which are important, but preventive aspects of your health. What can we do outside of medications, outside of all these different things to optimize your well-being and your health? Disease screening, which my colleague will be getting into in a few minutes too. This also plays a part in your senior annual visit. Many times, as you guys can imagine, when you're talking about, chronic condition A, B, or something that came up C or D, we can get lost in the trees. We can get lost where we're at. So again, it helps us take a look at to see how you are doing overall. And in addition to that, helps you coordinate care. Referral here, referral there at different types of appointments can kind of get confusing, for the patient or the family members going forward. So this visit helps coordinate that care, helps like, hey, maybe we need someone else. Maybe we need a community resource. Maybe we need a care manager if that's available, to really help hone in and be more efficient into these referrals and organizing your health overall. As I mentioned before, this is meant to be a step back from the visit-to-visit care. I mean, in theory, of course, as a physician, we always talk about some things during the wellness exam, but in its etiology, it's meant to be, let's take a step back. Let's not talk about the specific things per se, but more or less, as I mentioned before, overall health and overall well-being and just general concerns moving forward. We touch on a couple things and then a couple slides up. And again, this is to match your goals, your prognoses, and your values. Everyone has different values and has different goals about where they want to be, how you want to be in 5 years, how do you want to approach certain things, certain ailments, certain diseases, how do you want to approach disease screenings. And so this gives the opportunity for you and or a family member in the room with the physician to have a greater understanding of what you want, because at the end of the day, this visit is for you. This is to help you control how you want your health to be, how you want to optimize your health, and how to mitigate any risk in the future. These visits also play a big role in really assessing for any underreported conditions. And so again, there's some things, for instance, like dementia, one of those things, many times it goes underdiagnosed because we're so concerned with different types of medications and specific ailments that we discuss at each of the follow-up visits, that we forget, again, to take a step back and try to see, the fundamental aspects of health. I mean, how's your memory? How's ambulating? That type of thing. So for many common unreported conditions, this plays a big role in at least addressing it with your physician, especially with, as I mentioned before, a family member there, a loved one there. They can really assist in providing a story for you that really can bring up some of these things that aren't discussed on your day-to-day visits. And so what we see here, what does it consist of? We'll get into the components in a second, but what we have first off is just a geriatric assessment, going over your common medical problems, what cognitive, affective, or functional abilities or lack of abilities are going on with your health. I mean, are we forgetting things? Are we able to walk well? Does that hurt a lot? We'll get into it more in a second, but also the social and environmental factors that play a role in your overall health too. Do you live in a safe neighborhood? Is it safe to walk around the house? Or there's some trippy, or there's some fall risks involved? And so again, this is just a very basic approach in just assessing how we can mitigate risk in the future and optimize health. Furthermore, this is meant to age healthier. As we age, we want to enjoy what we're doing. We want to enjoy those walks going outside with family members. We want to enjoy doing different things at vacations as COVID's slowly coming to a close, hopefully. And so we want to age healthier. That's the point of these visits, is so much like, how can you set yourself up for success in 5 years, in 7 years, in 10 years, working with your family, working with your physicians. Let's age healthier. Let's age happier, to keep that improved quality of life, the really good mental health, keep your physical health as best as it can be. And that's where this type of visit really comes into play. And as I'd mentioned before, identifying unrecognized needs to improve your well-being. So again, sometimes there's these fundamental tenets of health that sometimes we forget to discuss. Are you sleeping? How's your pain? That type of thing, like we discussed before. These very basic things that we don't talk about so much when we're talking about high blood pressure or peripheral vascular disease or diabetes, these type of things. And so those tenets of health can play a long role or a big role, even in the specific conditions that we discuss on our day-to-day visits. And so, I challenge all of you that are listening, and I appreciate your time this morning, as we discuss this, think back. If you have a pen or a piece of paper, jot these things down. Oh yeah, here's an idea. Let me talk about this. And really think about it. If you're with a loved one too, talk about as we go through this presentation about what things do I want to discuss outside of my regular conditions that I have? Are there any concerns that I have? And again, we won't be, as physicians, won't be able to address every single thing, but these are things that are important as we start to think about how do we want to optimize ourselves going forward. And so here we go. What are the components of a senior annual wellness visit? Well, I'm sure you guys know, or at least the most of you know, like it involves paperwork, involves filling things out. And so there is a point to these. There really is. Sometimes it can be frustrating. You're sitting in the waiting room. I'm writing this down for the third time. Isn't it in my chart? Why are we asking this all the time? But it's important because sometimes things change. So we ask for demographics. What's your age, your gender, race, ethnicity. Well, these are important things. Yes, you may say, well, I'm 65, 70. Don't we already kind of know who I am? Yes, but again, it gives us an idea of increased risk factors for certain types of conditions, or the things that may come up that race or ethnicity or age or sex may play a role. An additional component of the health risk assessment is your self-assessment of your health status. How do you feel? Do you feel that your health is overall poor? Is it fair? Is it good? Is it excellent? This gives you a time to take a step back and say, overall, how do I feel? Where do I want to be? Where do I see myself in 5 years? How do I get there? And so again, by sharing that information with your physician, the physician has a better idea of how you feel. Because we can see at a chart, we can look at your chart and go over all these conditions, but how do you feel? And so that's an important part in helping us guide you to where you want to go and where you want to be. A third aspect of the health risk assessment is the psychosocial and behavior risks. Psychosocial, are you angry, lonely? Is there some depression in play? Is there some isolation? Is there some pain in play as well? Again, these type of symptoms, these types of feelings go a long way into your overall health. Behavioral risks. Are you smoking, or do you smoke? Are you active? Do you just walk around, or do you just enjoy biking around? What's your nutrition like? Alcohol intake. Again, these play very important roles into gauging how your overall health is and where you're at. A lot of these times we can do these types of screenings. If for instance, I have 3 to 4 beers, a week, okay. But if it's 3 to 4 beers or 5 beers a day, maybe there's something to be taught, and maybe there's something we can talk about. And it's at these times that's really important to bring it up, because again, we want to mitigate fall risk and that type of thing. If we're a little bit frail, we're having a couple drinks of alcohol, it's really important that these get brought up so that we catch things where it's almost a preventive aspect. We catch these things before worse outcomes occur. And the last point here, activities of daily living, which we'll get to further in a second, but still, it's are you doing your finances fine? Are you driving around, going to the store? How are your overall daily activities of living? Are they reduced because of some of these things that we discussed above? Again, and if so, how can we go about fixing that? What type of referral, what type of therapy should we try to apply, or what further, get more information for you to see how we can help you out in those regards. So that's the first component of it. The second component that we'll see is the medical and family history. Yeah, again, sometimes things don't change. So you're like, well, why am I filling out this again? Is it in my chart? But sometimes things change from year to year. We don't discuss it from visit to visit. So what are the medical events in your family that really increase your health risk? Is there a history of colon cancer? Is there a history of stroke or heart disease? And again, yes, you may say, well, 65, don't we already know this? But yes, maybe there's some additional info that may be helpful as we continue to work with you to optimize your health. In addition to that, your past medical history. Has something come up in the past year or since we last saw you that we haven't discussed in the past? And again, that goes into your medications and supplements. What type, regarding your medical history, what medications are you taking? And again, why are you taking those medications? I mean, you at home, if you sit there, think, do I know why I'm taking all the medications I'm taking? No, I'm not saying it's wrong that you're taking all these medications, but it's just understanding why. These are important things to overall wellness. Why am I taking this medication? Can I talk to my physician about weaning off of it? Now, again, I'm not saying it's going to be possible, but again, it's important to understand why we're taking these medications, and it kind of goes in with your past medical history. And as you see there from that third point too, what we see is supplements. In addition to your medications, what other supplements are you taking? Supplements, they can be fine, but again, we want to just be sure that we know what you're taking, because sometimes supplements can interact with the medications that you're currently taking for other conditions. So while supplements may be great, as I mentioned, again, it's important for us to know, and that's why we have these visits, so opposed to, all right, you're here for hypertension, let's talk about that. Are you taking your medication? Great. You're exercising? Great. But are there other supplements that you've started in the past that we just haven't got to? So again, take a step back, think about it, write these things down if you haven't brought it up with your physician, because it's really important to discuss during this type of visit. Last point here, history of substance use, alcohol, drugs, that type of thing. Those play a big role in your overall health, as I mentioned before. And so again, it's important to go over these things. If there's any types of screenings we need to do or assess this a little bit further, that's an important part of your medical history. A third component here is the very bottom, the identification of current providers. Now, again, this is very important because sometimes we have the ability just to go see a specialist without a referral. And so it's good to understand what specialist you're seeing. For the majority of time, vast number of physicians, we know where you're going. We usually refer you out. But again, sometimes there's some appointments that are made that we just don't know about, or you've started seeing someone else and we just don't get those notes in our system. So writing down the names of the physicians are really important. And yes, even so, if it hasn't changed in 20 years, I've seen Dr. So-and-so, my cardiologist, for 20 years. It's why do this? It's important to write these down so that we know what's going on and who you're seeing. So that way, if we have any questions, we can reach out to their clinic as well and try to, look at the chart and see what's going on there. Additional components. So again, to assess for cognitive function, as I hinted at before, many times dementia can be underdiagnosed, for many patients, vast majority of them. And so again, this allows us the time to have that patient-physician interaction. Again, as we're talking to you or we're talking to a family member, something seems a little bit off. This allows that time to really go and try to address those type of concerns. And bringing in your family member or bringing in a friend or a caregiver plays a huge role into helping identify things that you don't know as a person. Sometimes we just don't know what we don't know. We don't see that, we forget. And so having a friend or a family member there as you're sitting there listening to me chat about this, talk to your loved ones, see if there's anything else that seems a little bit off. I mean, because on a day-to-day basis, we really don't see how much we change ourselves, but maybe it takes someone else that doesn't see us as much that maybe notices some things and may be concerned of some things. So we can use cognitive tools and we can possibly treat and refer out. But again, this is just a component of it. For maybe the vast majority of you, this doesn't really play a big role. But again, it's just good to be aware that this is one of the components of your visit. Additionally, in addition to the cognitive function, but also review of potential risk factors for depression. And so, as I mentioned before, depression can play a big role, not only with elderly patients or senior patients, but everyone. But this is one of the bigger tools that we can use, or with a visit we can use to really assess for this. If we're depressed, we don't want to go outside. We don't want to be social once everything's safe to really do so. We don't want to go outside to walk around. We just want to stay inside. We're more sedentary. And again, being sedentary leads to increased risk or an increased risk for multiple conditions that can even be exacerbated with the ones that we already have. And so again, being truthful, being honest on that form as you fill it on out, plays a big role in your overall health. So these little things, while they may seem tedious and why do I fill these out all the time? Again, they play a big role and can really help your physician help you. Because at the end of the day, that's what this visit's for. Help us help you. An additional component that we also go over is just reviewing the functional ability and the level of safety that either at the house or just with you overall. And so as I mentioned before, the ability to complete activities of daily living. Are you able to prepare your own food? Are you able to do your own laundry, your housekeeping, that type of thing? If it's more difficult to do so, why is that? Why is it more difficult? Is it because of pain? Perfect. So sorry about that, everyone. Let me fix everything right here. There we go. So as I was saying, that one of the other components too, in regards to, just your daily activities of living, are you able to toilet yourself, feed yourself, bathe yourself? That's an important aspect of your overall health. And so again, our next point here is regarding your fall risk. Have you fallen before in the past or the past year? If so, how many times? Why did you fall? And so again, if that's you on the other side here, think about it. What happened? Did I trip over something? Was I a little bit dizzy? Was I not eating enough that day? And so again, identifying fall risk, not only with how we feel overall, but within the house too. Is the hallway I walk through to get through my room, is it dark? Is it well lit? Are there rugs there? Are there tables or something that kind of jut out that we're not used to, that we sometimes forget or we just kind of run into? So again, identifying those fall risks go a long way into preventing issues going into the future. Goes into home safety too, same type of thing, making sure that everything's safe, the rugs are flat, there's nothing that we can trip on. And regarding getting it in and out of the house, is there a couple steps? Is there a railing there? Is there any other type of tripping objects or things that we can trip over at the house? One of the biggest things that we see too, or not one of the biggest things, but one of the things that may be a huge burden for a lot of our patients, it may be you, maybe not, is just urinary incontinence. This goes a long way in regards to wanting to go out and being with family or going for a walk. Well, I don't want to go for a walk anymore if I'm having this issue. And again, this plays a huge role with mental health, and let us help us help you in regards to this type of thing. So that's why we have you fill out these questionnaires if you've experienced anything like that. If there's a burden in your life if this is a burden in your life that prevents you from doing things, let us know, because this is what this appointment is for. It shouldn't be an embarrassing thing. Let us help you out. Other things that, if it's an issue that we see during the appointment, something we can bring up is just regarding hearing and or visual impairments. Sometimes as we go about life, we just like, oh yeah, this is just how I hear. We forget where our threshold was years back, and we just accept what is normal now. And so if there's trouble hearing, for instance, the other day I was working with a patient, and I was asking the patient, when was the last time you had your hearing checked? Have you ever had it checked? And it was, no, I haven't. And this is after talking to the patient in the room, asking the patient multiple times, looking at the patient's face, and I could tell there was still some trouble hearing. And so again, as we discuss certain things during the visit, we kind of identify things that can ultimately help your health going forward. And so we're able to help with this patient by sending them over to a specialist to be evaluated for some possible hearing aids. So again, the role of this appointment can't be understated. The last point here that you'll see is weight loss and malnutrition. And so sometimes we do see this as well. But again, it allows us, this type of visit allows us to trend your weights from the past and to see, okay, are we gaining weight? Are we losing weight? If we're losing weight, is it intentional? Is it unintentional? Are we eating enough food? If not, why aren't we eating enough food? And so this plays another important part in just your overall health, and the nutrition aspect of it, and having strong bones, strong muscles prevent different types of things in the future. So this allows us to really catch and really talk about these issues if it's pertinent. And so as we go into this last component of your senior annual wellness visit, is to really establish a personalized prevention plan. And so you'll see this first thing, a written screen schedule. Well, I need to write out what I need to do over the next 10 years. No, not necessarily, but it's just what the point of this is just having an idea of what to expect, right? Am I going to be getting another colonoscopy? Do I need one? Let's talk to my physician about that. All these type of screens, at least that you have an idea, an expectation of what we're thinking, how we can help you out. Discussion of immunizations, which my colleague Dr. Tornell will be discussing as well. Again, establishing a plan, addressing any concerns with those immunizations, goes a long way into addressing any fears or any hesitancy into receiving those. Going over a list of risk factors, with current interventions, what are those risk factors that set you up for a possible condition X or poor health come in the future? Are there any interventions that we can take part in, that we can refer to you right now going forward? The last couple of points, personalized health advice. So what this isn't a cookie cutter type of appointment. This is for you, remember. And so, addressing specific needs or needs that are addressed in this visit and offering personal advice goes a long way as well into making sure that you are following a plan that you want to follow. That's the most important thing. Referrals to reduce risk and promote wellness, excuse me. Again, sending you up if it's with a nutritionist, if we have diabetes, or if it's with physical therapy for deconditioning or for some pain, to reduce risk and promote wellness, because that's the most important thing. I hope you guys get out of this is that don't be afraid to ask for things. Don't be afraid to ask about things during this type of visit, about issues that haven't been addressed at your regular visits with your physician. This is the time to do it. Now, again, can we address all of them? No, maybe not. But again, at least puts it on the radar that it can be discussed at another time, or setting up an additional appointment to discuss those concerns as well. This last point, and again, I appreciate everyone's attention and your time, and I apologize for that delay a little bit ago. I almost should have put this as its own bullet point, or it's in a red font or a color, but your advanced directive. This is so important. Advanced directive, what is it? In essence, it's pretty much, how do you want your treatment to be in the future? If you can't speak for yourself, who makes medical decisions for you? What type of medical treatment do you want if you're incapacitated and unable to speak for yourself? This is so important to just have it completed. Talk to your family, talk to loved ones about this, about what you want. What are your values? How much support do you want at end of life, if that's what it comes down to? Because all of us, from me to everyone else, we should all have one, because we never know what's going to happen. It's not so much picking on, let's talk about this to our older population. No, everyone should have one, because again, if anything should happen, we want our family there to be supportive and to be there, spiritually, mentally, physically for you, and not having to worry about who's making the decisions for you. What do you want? My grandfather, my father wants this, and someone says, no, they want that. Write it out. Have the conversation with your family, or if not, just write one out, give it to your physician so we can put it in your chart, because this is so important. Some people prefer one things and some other people prefer other things to end of life care. So again, if you're with a loved one right now, or if you're writing it down, write this stuff down. What do you want in your advanced directive? Put it down, give it to us, so that way everything's understood. And lastly, if you have written one down, oh yeah, I did it like a couple of years ago. Has anything changed? Has anything changed in your life where, okay, well, maybe I feel like I want to go down this road as opposed to the other road? Or maybe whoever's making decisions for me, maybe I want to change that person, maybe not. But again, constantly thinking about these things is very important, so that if it ever comes to that, it's already addressed and no one has to worry about it. So in summary, this is just a brief couple bullet points that don't encompass everything that we talked about. But again, the senior annual wellness visit is a multi-component appointment. So again, it's a little bit extended. We talk about preventive medicine, functional and cognitive issues, your mental health, review of medications and the supplements, advanced care planning, personalized care, that type of thing. And at the end of the day, I just want to make sure that the getaway is that this is a pathway for your health. It's not so much us dictating what you should be doing. Yes, we would provide recommendations and guidelines or recommendations. But again, what do you want? At the end of the day, if you don't want certain things, we can discuss it, and then that way we know. So this is for you. And again, it's underutilized. I'm sure many of you are already going to these, but again, get your family members to do one. If you know they live out of state, live in a different part of town, make sure they go see their physician. Because at the end of the day, yes, we want to make sure we treat you there, but overall, we want your family members to be healthy. We want everyone to live long, prosperous, high quality of life lives. And so again, it's underutilized. Use it. It's for you. We want to help you out. Again, thank you so much for your time. Sorry for that interruption. Who knows what happened, but thank you for sticking with me here. And right now, I give it off to Dr. Torn, and she'll be discussing vaccines and screenings.
Good morning. Good morning, and thank you so much for being with us this morning. Thank you, Dr. Mejia, for wonderful presentation. Today, we will talk more about cancer screening, vaccine preventable diseases, and vaccines, and why they are important, and a role of primary care in your health. General practice or primary care, if it's first point to contact with the patient with a health issue and is key component of primary care. Primary care providers for continued and comprehensive health care for individuals. They not only treat ill patients, but they also work with healthy, strong, healthy patients to maintain skills through disease prevention and health education. Clinical preventable services includes screening tests and counseling to prevent diseases and progression of diseases. And it was very important tools to maintain health and functional independence of adults. Preventive services can be done in your doctor's office. Importance of vaccine in adults. Why vaccines are important? Because it protects you from diseases, many of them infectious and deadly. Protects anyone you come in contact who cannot get vaccinated. For example, infants, they're too young to get vaccines, older grandparents and family members that more vulnerable to diseases, and people with medical condition whose immune system weakened. How do vaccines work? Vaccines work to train your immune system. Vaccines create antibodies. It's a proteins in your body that recognize different viruses, bacteria, and other substances, foreign substances, and then fight them. Vaccines usually contain inactive part of the virus, bacteria, or foreign substance that cause immune response in the body. There are some misconceptions about vaccines. For example, vaccines can cause people to get sick, natural immunity healthier and more effective, and vaccines cause autism. Vaccines cause immune response in the body and can train your body to fight disease. And that's why sometimes after getting vaccine, you can feel sick. Vaccines give you ability to build immune system without possibly damaging effect to your body from disease. And a rumor was spread about linking MMR vaccine to autism, unproven and unfounded. Why are adults at risk? As we age, our immune system becomes weaker and we are vulnerable to infections. Older adults at high risk to contracting and developing serious complications from influenza, pneumonia, or shingles. Vaccine preventable disease are expensive. For example, having flu, adult can miss an average of 6 work days. All adults need flu shot, influenza vaccine every year, tetanus vaccine every 10 years, zoster vaccine at age of 60, some agencies recommend at the age of 50, and 1 or 2 pneumococcal vaccine at age of 65. Depends on different factors, adults might need more vaccine. Health condition, diabetes, heart problem, kidney problem, immunodeficiency, job. If you're a healthcare worker, you might need more vaccinations. International travelers need certain vaccine for certain area and vaccines you didn't receive as a child. Adult vaccines are pneumococcal, meningitis, flu vaccine, shingles, tetanus, hepatitis A, hepatitis B, chickenpox, HPV, MMR. We'll talk about vaccine preventable diseases, which is shingles, hepatitis B, influenza, pertussis, and pneumococcal disease. Shingles. Every year, 1 million people experiencing this painful skin rash, usually with blisters. Shingles can cause fever, headache, chills, upset stomach, rarely can lead to pneumonia, blindness, hearing problem, brain inflammation, encephalitis, or death. About 10 to 18% of people who get shingles will experiencing after shingles condition, which cause post-herpetic neuralgia. The pain can last for months. Hepatitis B caused by virus, which attacks your liver, can lead to liver failure, liver cancer, cirrhosis, and death. There are about 35,000 cases a year and 90% among adults. Influenza is a contagious disease that cause of an infection of nose, throat, and sometimes lungs, can range from mild to severe illness, at times can lead to death. This disease causes 39 to 49,000 deaths a year and more than 200,000 hospitalizations per year. Pneumonia is an infection that inflames your air sacs and lungs, causing you cough and difficulties breathing. Near 40,000 cases of invasive pneumonia disease, resulting in 4,000 deaths. It's a high percentage, 10%. Tdap. T stands for painful stiffening of the muscle. It stands for tetanus. Tetanus can lead to serious health problems. Difficulties to open your mouth, having trouble swallowing and breathing, and even death. D stands for diphtheria, which can give you difficulties breathing, heart failure, paralysis, and death. Pertussis, also known as whooping cough, can cause violent coughing, making it hard to breathe, eat, and drink. It could be very dangerous in babies and young children. According to case count in 1940s, case exceeded 100,000 cases a year, which was down to 10,000 cases by 1965. And Tdap was invented in early 50s. During 1980s, it began to increase and it reached 28,000 cases in year of 2013 and 14. And according to cases report nationwide in 2018, it was little over 15,000 cases. Important information about each vaccine. CDC recommends for everyone older than 6 months to get flu vaccine by the end of October each year. Those that are 65 and older are more at risk of developing complications from flu. 70 to 85% of the seasonal flu-related deaths have occurred in those who are 65 and up. 50 to 70 of seasonal flu-related hospitalization in the same age group. Person age of 65 and older need to have 1 dose of vaccine appropriate to his age and health status annually. Pneumonia vaccine protects against pneumonia, meningitis, and bloodstream infections. For example, flu-related complication of pneumonia, it's a flu-complicated complication and it can lead to death. For those who is 65 and older, if you receive pneumococcal vaccine prior to age of 65, then you will need to administer 1 dose of at least 5 years after your previous dose. If you not administered previously at age of 65, you need to get 2 vaccines, PCV13 and PPCV23. And it should not be administered at the same time. It should be spaced 1 year apart, and PCV13 should go first. In special situation, if there is immunodeficiency or HIV, chronic kidney failure, heart failure, COPD, Vaccine could be given patient 90 years and older. Tetanus vaccine, Tdap. If previously not received Tdap at age of 11 or after, you need to get first dose of Tdap and then TD and Tdap every 10 years. Person with 3 or more doses of Tdap vaccine for wound management for clean wound, administer 1 dose of Tdap or TD if more than 10 years since last dose. For all other wounds, administer Tdap or TD if more than 5 years since last dose of Tdap. Tdap preferred for person who previously not received Tdap vaccine before or history of Tdap vaccine unknown. And Tdap should be used for pregnant individuals with each pregnancy. Zoster vaccine, there is 2 types. One is Zostavax, which is live vaccine weakened form, 1 single dose, not recommended for immunocompromised patients. Second vaccine, Shingrix, is 2-dose series, should be given 2 to 6 months apart, regardless previous shingles disease or previous vaccination with Zostavax. Shingrix, 97% effective preventing shingles in adults 50 to 69 years old, and 91% adult older than 70. Zostavax has 70% rate of preventing shingles age of 50 to 69, and 41% in population of 70 to 79. Important current vaccine information. COVID-19 vaccine, it's a messenger RNA COVID vaccine. Pfizer, Moderna, and Johnson & Johnson are authorized and recommended in United States and protects against COVID-19 related hospitalization in adults 65 years and older. Fully vaccinated adults were 94% less likely to be hospitalized with COVID-19 than people at the same age who did not get vaccinated. Partially vaccinated are only 64% less likely. How many people in US have been vaccinated against COVID-19? According to CDC, Center of Disease Control and Prevention, as of May 20th of 2021, 48% of total US population has received at least 1 dose, and 38.1% of total US population is fully vaccinated. Partially vaccinated, it's people 2 weeks after first vaccine, and fully vaccinated 2 weeks after second vaccine. Vaccines are important. Adult needs to protect themselves against a number of common and serious diseases. Vaccines are safe and necessary as vaccine preventable diseases kills tens of thousands US adults each year. Vaccines prevents not only you to get sick, but also prevent you being hospitalized or dying from disease. And you protect not only yourself, you protect your loved ones and community. Where can you get a vaccine? You can get them at your doctor's office, pharmacies, clinics, workplaces if offered, or public health departments. Most adults' vaccines are covered by private insurance, and those are who 65 and eligible for Medicaid and Medicare will be covered vaccines. Adults without health insurance can visit www.healthcare.gov and contact their local health department for information about their vaccine coverage. Second topic I would like to discuss today, and which is very important as well, it's a cancer screening. The point of screening is to examine a patient for cancer before you start developing symptoms. Getting screening tests regularly may find breast, cervical, colorectal cancer, or lung cancer early when treatment is likely to be success. Breast cancer screening recommended at the age of 40 yearly, and US Preventive Task Force recommend that individuals who are 50 to 74 in average risk of breast cancer to get mammogram every 2 years. A mammogram is an X-ray of your breast. MRI used along with mammogram to screen individuals who has high risk getting breast cancer, personal history or family history, and breast MRI uses magnets and radio waves to take pictures of the breast. Additional clinical exam by your family provider, family doctor will feel for lungs or any changes in your breast. And also you can expect your breast to see if there's any changes to look or feel of your breast. And if you have any changes, it's very important to discuss with your doctor. Cervical cancer screening. There's 2 tests that prevent or find cervical cancer early. Pap smear looks for precancerous cells changes on your cervix, which may become cervical cancer if not treated appropriately at the right time. HPV tests look for viruses which can cause these changes in your cervix. Both tests can be administered in doctor's office or clinic. If your result normal, your doctor will tell you wait 3 years until your next pap smear test. If you are older than 65, your doctor may tell you you don't need to have screening anymore if you had normal screening test results for several years, or you had your cervix removed as part of total or partial hysterectomy and non-cancerous condition like fibrosis. Colorectal cancer. The recommendations changed, and Preventive Task recommends adults 45 and 75 years old to screen for colorectal cancer. The decision should be made for older than 75 on case-by-case basis. People at the increased screen for colon cancer should talk to their doctor about what time to begin screening, what test is right for them, and how often they need to have tested. Different tests for screening of colorectal cancer. Stool test, FOBT, will look for occult blood in your stool and should be done once a year. FIT test use antibodies to detect blood in a stool and should be done once a year. Test FIT DNA, it's a combined test FIT, which tests to detect altered DNA in stool, which should be done every 3 years. Flexible sigmoidoscopy, more invasive tests, check for polyps and cancer in your rectum and lower third of your colon, which done every 5 years or every 10 years along with FIT, which done yearly. Colonoscopy checks for polyps and cancer inside of your rectum and entire colon, which is done every 10 years for people who has no risk for colorectal cancer. For those patients who have family history of colon cancer, screening should be done 10 years earlier than it was found on family member. Lung cancer. United States Preventive Task Force recommends a yearly lung cancer screening for people 50 to 80 years of age who has history of heavy smoking, 20 to 30 packs a year or more, and smoke now and have quit smoking within last 15 years. Lung cancer screening done through the CT scan, which is X-ray with low amount of radiation, and you used to take photos of your lungs. And best way to avoid lung cancer is do not smoke or avoid secondhand smoking. Prostate cancer. Screening check the level of PSA in your blood. If the PSA is high, then it could be a sign of a prostate cancer or any prostate diseases. For people average risk 40 to 54, they may not be recommended to screen. For people aged 55 to 69, decision to screen should be made on case-by-case basis. And Preventive Task Force recommends again prostate screening for prostate cancer in men 70 years and older. Number of organizations provide different guidelines on screening of cancer. Sometimes those guidelines suggest different things. It varies on which type of cancer people should screen for, which test should be used, what age screening should be begin and end, and how often screening tests should be done. What happens if screening shows positive results? I suggest you talk to your doctor about your personal risk of developing cancer. Together, you and your doctor can decide on appropriate screening schedule based on your age, personal and family history of any diseases or cancer. Thank you for your attention, and I can answer questions.
Hi, everyone. I'd like to thank both of our presenters here today, Dr. Torna and Dr. Mejia. Great presentations, very informative. I invite anyone who's still with us to please stick around for just a few Q&As. But before we do that, I would like to invite you all on Wednesday to join Torrance Memorial's IPA. They will be discussing more of your Medicare options at their next webinar, Medicare 201 Beyond the Basics. So I encourage you all to attend if you want to learn more about that. Now going to the Q&A, I have two questions for Dr. Torna.
Okay.
Sharon would like to know, do you need to get a tetanus shot every 10 years only if you get an infected cut? I guess either one can answer, but.
Hi, Sharon. You need to get your tetanus shot every year, despite if you have any cuts. And for wound management, it's a different. If you had your tetanus shot within 10 years, then you're good to go for clean wound. But if you had your tetanus shot longer than 10 years, you need to get for dirty wound, you need to get your shot in 5 years. I guess I messed up a little bit. For wound care, for dirty wounds, you need to get your shot if you're 5 years of the last one, and for clean wound, it would be 10 years.
Okay, thank you. Dr. Mejia, Linda had asked, how does one go about scheduling a wellness visit with a primary care doctor? I basically said to call the office, her primary care office, to schedule a senior annual wellness. But if there's anything else you want to add to that.
No, I think that's the best approach. I mean, each clinic may operate a little bit differently. What we do is you can go online to the TMPN website or just type in Torrance Memorial Physician Network, look at the different types of clinics, whichever one's nearest to you, and give that number a call. I know when you go to Hermosa Beach, that number gives you either to Conchetta or Kim, who are wonderful over here, and they can help address, just make sure that they can set you up with the appropriate physician for your wellness exam too. So that would be the way to go about it over here at Hermosa Beach. And I'm guessing that's pretty much how you go with it, either in Manhattan Beach and Palos Verdes, where Dr. Torna is, moving forward.
Thank you. Linda also had a question for Dr. Torna. What is the advantage of getting 2 shots shingles regime over a single shot?
The advantages is percentage of preventive from shingles disease. Shingrix, it's 2 doses of disease, and it works for preventing 97 to 91%. And Zostavax, it's a 1-dose shot, which is live vaccine. And it's only 70% of preventive of the shingles disease.
Thank you. And that's pretty much all the Q&As we have for now. Once again, thank you everyone for attending. Thank you, Dr. Mejia, and thank you, Dr. Torna,